Do specific viruses like EBV increase CFS-ME risk? Imagine catching a virus and never quite feeling the same afterward. That's often the case for some people who develop chronic fatigue syndrome or myalgic encephalomyelitis, a complex condition causing persistent exhaustion and other symptoms. One virus that has been studied extensively in this context is the Epstein-Barr virus, or EBV. This virus is best known for causing infectious mononucleosis, sometimes called the kissing disease, but it can also stay hidden in the body for years. Research shows that infection with EBV can increase the risk of developing CFS or ME, especially in certain circumstances. When someone gets infected with EBV, especially if the illness is severe, there's a higher chance they might develop ongoing symptoms. Studies indicate that about 9 to 12% of people who experience infectious mononucleosis go on to develop CFS or ME within 6 months. This is a notable increase compared to other common infections, suggesting EBV has a specific role as a trigger. The severity of the initial illness matters too. If the infection causes intense symptoms like gastrointestinal issues or autonomic nervous system problems, the risk of long-term fatigue and related symptoms rises. Scientists believe that the immune response plays a big part in this process. Some individuals who develop CFS or ME after EBV infection seem to have immune systems that don't respond normally. For example, they may have trouble clearing the virus effectively because their B and T cells, which are crucial for fighting infections, don't develop strong memory responses. This can allow the virus to remain latent in the body and cause ongoing immune activation or inflammation, which might contribute to fatigue and other symptoms. Genetics also seem to influence this risk. Certain genetic markers, like specific human leukocyte antigen alleles, might make some people more prone to immune system issues with EBV. This genetic susceptibility can impair the body's ability to control the virus, increasing the chance of developing chronic symptoms. On a biological level, EBV might produce proteins that lead to neuroinflammation, which can disrupt brain function. This inflammation can affect neurotransmitter systems involved in mood, sleep, and energy regulation, all of which are affected in CFS and ME. Laboratory tests in some patients show elevated antibodies to early EBV antigens and increased inflammatory cytokines, which can support the link between the virus and ongoing symptoms. It's important to remember that not everyone who gets EBV will develop CFS or ME. Many people recover fully from infectious mononucleosis without long-term issues. The development of chronic fatigue appears to involve a combination of factors, including immune response, genetic predisposition, and possibly other environmental influences. If you've had a severe EBV infection and are experiencing prolonged fatigue or other symptoms, it's essential to seek medical advice. Healthcare professionals can evaluate your symptoms, run appropriate tests, and help determine the cause. While research is ongoing into targeted treatments, including antiviral therapies, there is currently no standard antiviral treatment proven to cure CFS or ME. Understanding the role of viruses like EBV helps in recognizing potential triggers and guiding management strategies. Remember, each person's experience is unique, and personalized medical care is key to addressing complex conditions like CFS and ME.